Okay, so looking at the next procedure, which is kind of like a minor type of surgery which could be done on the cervix. This is what is known as the LEEP procedure. So full meaning of LEEP is what? Loop Electrosurgical Excision Procedure. Okay, so let's go around it. So it's a common and effective treatment which is used to remove any abnormal or precancerous tissues from the cervix. So it's often recommended after they have done a pap smear test and they see that it's abnormal, or maybe what the cervix is showing some dysplasias and all of that. All right, and all of that, so you basically go in for this, so you can remove tissues just to prevent maybe there's a possibility of cancer letting not spread. So what happens during the LEEP? A thin wire loop is heated with an electric current. Now the loop is used to cut away abnormal tissues. Can you see this? This is it. This is the what? Electrosurgical loop. The end is just a wire, so they just use that wire fetch out the top of the cervix. Please pause this video to look at this. It's very important. So the procedure typically takes 10 to 20 minutes and is done in a clinic or a doctor's office. Local anesthesia is used to numb the cervix, all right, and all of that. So why is it done? Maybe to treat precancerous, just want to prevent. Okay, also to diagnose or remove genital warts, maybe polyps or any abnormal growth, maybe to prevent progression to cervical cancer. So recovery and aftercare: mild cramping and vaginal discharge. All right, so avoid tampons or sex or strenuous activities for at least that time they are recovering. Full healing takes what? 4 to 6 weeks. So follow up pap smears and what? Human papilloma virus tests can also help. So risks and considerations: well, infections, bleeding is something that is common in almost every procedure. Scarring of the cervix, slight increase in the risk of preterm birth because your cervix is not thick again to keep a baby up. Okay.